this is Coach Tess from HealthEversity, and today we are going to do something a little different. We will be talking about radiology, which is pretty much procedures and not diagnoses or anatomical word identification. So this section of the board CPC board exam is mainly procedures done. Okay, and now we'll be focusing a lot on the surgical suffixes. Okay, but then you'll identify the suffixes, but you'll see the body part on the left of the word. So this highlighter, I use the green, but then look at this. I have all these colors that I use in my CPT manual right here, right there. See, colors of the rainbow. So my green is what I use for identifying my procedures in my book, okay? So let's jump right into it. So you see, you have angiography. So it's all procedures here. So you'll notice that graphy, right, is a radiological image of blood vessels. So graphy, so if you see graphy right here, beside graphy, there's angio. Angio is a blood vessel. So look at that. So you are now doing an imaging of the blood vessel. Look at arthro. Look at the top. You have angio and you have arthrography, right? Okay. Look at arthroectomy. Removal of plaque from an artery. So that's an ectomy. Okay, brachytherapy. So this section is super good because it covers everybody. All of the sections of the CPT manual, and this will just give you a lot of where your surgical suffixes are, as well a lot of the terms throughout the book. Okay, so you have brachytherapy, bronchography, right? So now they're doing so if you notice repeated, so they're radiological imaging, right, of the bronchi. So you use graphy again, and to your left is your body part. Pretty easy. All right, cephallogram of the head. So they're doing a radiological image of the head. All right, so it's good that you know your anatomical sides. Oh, look at this. Radiographic image of the bile ducts. So you're using the graphy right here of the bile duct. Then you have radiography of an organ. Okay, look at that. Colonography, same thing of what? The colon. Okay, so it's good that this is easy. This section will help you to find, to identify your procedures. Very easy, and this is a good exercise. Okay, computed thermography, CT, right? Okay, corpora carnivorous graphy. All right, see what it says, the image of a corpora draining veins. And you know what? This could be during an autopsy, not autopsy, when they're doing things for people who have died, okay? All right, cystography. All right, radiographic image of the bladder. Graphy and then cysto of the bladder. So this section is very important. Okay, all right, so let's move on to the next page and let's look at this now. Let's put it down. And the reason why I do it this way, not what all these other instructors do, is, I'm not hitting out against other instructors, but a lot of them do PowerPoints. This is more how you actually study, right? So this is what you're going to do. Hold the book up and look at it. And that's exactly what we're doing. Look at this now. Graphy. And that's how you study. You put your finger on the thing and look at the term. And we're doing that same way. So look at graphy right here. Graphy. And then you have dacrocynthro, right? Radio image of the lacrimal drainage system. Okay, discography. See there? It's the same thing. So what graphy is? That means this is a procedure right here. Okay, Doppler, a type of ultrasound. And then these terms you'll see as you go along in radiology. And a lot of it comes on the CPC exam, a lot of it, okay? But you don't know what is coming, but just be prepared. Okay, docogram, duodenography. Look at the examination of the duodenum and the pancreas. ECG, imaging using sound waves. Okay, a lot of the times when you go to the emergency room, they perform an ECG. Echocardiography, ectoemphal, I can't pronounce. It's pertaining. It is now pertaining to the brain. I never ever can pronounce this word. Somebody help me pronounce it. Enphal. This is a part of the brain. So you have echo and then you have enphal. How do you pronounce the brain? I can't remember. Is it just the name? It's always a problem for me. And I try to be as natural and human as possible. Okay? Because I really don't know how to pronounce it properly. But a lot of these terms, it's why I say this, is that a lot of the times we can't pronounce some of these terms. It's true. Right? We can identify them, but don't feel bad. As I make fun of myself all the time. Don't feel bad. Okay? All right? So you have epidurography. Epidural space in the spine. Fluoroscopy, right here. That's a very popular one. Is what I'd call it is like a moving x-ray. Fluoroscopy. Or sometimes people say fluoro. Okay? So scopy, right? They use the scopy, and that give you that examination term. Okay? All right. Hypothermia. Okay. All right, type of cancer. This is not a procedure. No, this is not a procedure. Okay. All right. So you have the hysterosalvography. Guess what they're doing? They're doing the uterus and the fallopian tube. See, look right here. So they're doing the graphy, fluoro imaging, and you come across here, histo of the uterus and the salpingo. Salpingo is the fallopian tube. So it's good that you know these terms. Okay? All right. Laryngoscopy. Radiographic image of the larynx. Graphy. So if you notice that this term radiographic image is repeated again over and over. So this section will help to learn a lot about your surgical suffixes. Lymphingography. Okay, let's move on. Magnetic resonance. So that's like your MRI or MRA. Okay. Myelography of the spinal cord. Nymphotomography of the kidneys. Orthoplantogram and pancreography. So what they're doing pertaining to the pancreas. All right, so let's move up to this one. All right, look at PET. That's a very popular one on the test. Portography, pylography, shuntogram. So you have graphy, you have ectomy, you have gram, all of these. So ectomy is more surgical. But if you notice that you're seeing a lot of graphies and you see a lot of scopies, these are different types of surgical procedures, right? Okay? And then this is not surgical. This is just basically a lot of them are non-invasive, which meaning that they're not going inside of the body. They're not cutting inside the body, they're not going inside of the body. A lot of it is external. Okay? All right, so SPECT, that's another one. So you have PET and you have SPECT. See? Know the difference because you might get both codes. So you need to know the difference. When you go on the test, you go say, okay, they say SPECT versus PET. So you have to know the difference. Okay? Sonography, sonohistogram of the ultrasound of the uterus. And then this one has to do with splenoportogram, telegraphy, transcatheter performed. Okay, ultrasound. We already know what ultrasound is. Pretty much a common. It's sound waves, and they pretty much see imaging. For example, in your pregnancy, you will see that on the test. They're talking about different uterus of the fetal, all of those, the fetus, sorry. So those are some of the things that you're going to see. Okay, urethrocytography, urography, vastography, velocitomapping, venography, and extra radiography. So this one is pretty interesting and very different. So guess what? If you have any questions, send us a message. And have a good one.